It's common for kids to get ear infections, but right now infections are significantly on the rise. The Iowa ENT Center says ear infections are up about 150% compared to past years. So that means more kids in pain and discomfort. Here to tell us about what could be behind the spike is Dr. Eitan Young. He's a pediatric ENT physician with Iowa ENT Center. Dr. Young, thanks for joining us this afternoon.
Thank you for having me.
I was asking you about your month and you said, exactly.
It's been a big month. You were asking earlier, like why are we seeing such a spike? And it's directly correlated to the last month. If you look back, see how many people were sick. Adults got the flu, COVID, children were getting RSV, the hospitals were busting at the seams again. And we tend to see a delay, and then about a month later, ear infections start to arise. And that's exactly what we're seeing right now.
There's a reason for that. You said, your body's been fighting off the flu, fighting off any other bugs, and then that obviously takes a toll. So then you start to get worn down a little bit more.
Right, and so it could be your parents. Your parents could be worn down. Maybe your brother or an older sibling had the flu, but they'll bring in another illness in the family. That viral illness will trigger that young child to have an ear infection, and lo and behold, the numbers start to rise.
Okay, so let's talk about symptoms, right? I mean, obviously you would think some kind of pain, but what is the level of discomfort? And when you're talking about kids, it's can be tricky.
Yeah, that's the hard part. So you'll have parents come in and swear, gosh, my child is sick, my child has an ear infection. And you'll ask why. He says, well, he can't sleep anymore. That's one of the earliest signs. Doesn't sleep through the night. And pulling at an ear. And oh gosh, guess what? They have a fever. And when these things come together, and sometimes even drainage, usually parents are quite savvy and they'll bring their child in to see their pediatrician or their primary. Fever is a very important sign of an illness, and that pediatrician and primary then has to decide where to go with that.
First off, they might try to treat something at the beginning before they come to see you?
Yes, they are treated for a number of infections before they come to our office. So usually we'll see a child after 4 or 5 diagnosed ear infections, and the pediatrician again, or the primary at that point says, you're starting to develop a pattern that's more than just the occasional infection. You probably need some more attention. And that's when we will see them in the office. Yeah,
I was asking you, you hear about kids getting tubes in their ear, and you said that's what you do day in, day out.
This time of year. And this time of year, things will get busy enough that at times in the years past, and we're thinking about it again this year, we'll even open extra time, extra operative time, maybe a weekend, trying to get through the backlog of children who really, truly need extra help.
Yeah, let's talk about that waiting list. That's something that you wouldn't even think when you're talking about, time is of the essence if kids aren't sleeping, over and over.
You have parents who are frustrated, but also children who are just truly sick. And so, yes, you can treat them over and over again with antibiotics, but at some point, once you've decided that child needs a set of tubes, it's really hard to tell a family, and I'll see you next month in the operating room. So you really have to provide them with that availability. It's very important.
As far as preventative measures, we always hear the same thing, and it's probably because it is the best medicine, trying to stay healthy, wash your hands, those kind of things.
True.
But what other things can parents, caregivers, et cetera, do right now?
It is not a popular thing to say out loud, but vaccination. And it has to do with everyone being vaccinated. So public health will tell us that these numbers, like I alluded to earlier, numbers go up when the general community is not vaccinated. And so the more we are vaccinated as a community, the easier it is for children. And it doesn't seem logical because it doesn't make any sense, but that's really where it lies. That and of course common sense, hygiene, but also daycare. You have children who are sick, don't bring your child in. If they have a fever, don't let that child spread the illness to the next one down the line.
Now, when you bring up vaccines, that is interesting because as kids, they do get a lot of vaccines, and most of us at that time, that's when we're constantly getting vaccines. But now you're talking about, the flu, the COVID, all of those things, RSV.
Yes, but we're talking about the community, and that's the part that's hardest to understand, even, in any circumstance. It's the community of Des Moines, once better vaccinated, then we see a better management of otitis media. And that comes from the studies that I talked about earlier. The more vaccinated we are, the healthier we are in general, and ear infections are no exception.
All right, Dr. Young, an interesting conversation, some good advice, and then just talking about just how busy you've been.
Yeah, We had a nice break during COVID when everyone was home, and
now-
that worked out well. There were no ear infections, but now things are back with a vengeance. And I like to say you can't trick Mother Nature. She comes back and she hits hard sometimes.
Right. Well, that's what we're seeing now. We appreciate your time this afternoon, and we will be right back with more news after this.